our case 2 to all of you who have two-site systems. My question to you is, do you think you're safe from PRRS? Well, this next case of a respiratory form of PRRS shows us no farm is safe from this virus. And so I call on Dr. Apisit Kitawarnrat to share his case of a respiratory form of PRRS. Dr. Apisit, please take it away.
Okay, thanks, Carlo, for my turn. And I feel like overwhelmed with informative data. And there's many good points that when I go back to my farm, I think this is we need to think about the PRRS again. So let's see. How about my case? So before we go to the detail of the case study, let me explain about the production pattern from the CP. Actually, I think it's the same as a production pattern in Asian country, but for CP as a pig production, we have 4 kinds of the production system. First, this is all-site system or one-site system. As you know that every production unit at the same location. For example, breeder and gestation, nursery, finishing in the same location. This is really popular in the past, but we will talk about this, the problem later. And the next generation, when we know about the two-site system, okay, we change our pattern to the two-site system. But the two-site system in the past, we do like two big side of the south part and the win to finish part. And well, this is not, I think we know that this is not answer our pain point. We still have the same problem. So the current major production pattern of our company is a two-site system with the multi-loci. We have both kind of two-site that with the contact farming for the sow unit with the batch following, and we need the piglet to the contact farming to the site 2. And also we have like a big system that the south side with the really high population of the sow number. And then we weekly weaning piglet to the site 2 for the contact farming. This is overall the 80% of our production. So let's start our like a one-site system. As I mentioned before, that this system for our company, and we still have like in the PRRS positive farm that once the PRRS come to your farm, is really difficult to eliminate, and we also on and off unstable PRRS on sow problem, and continue secondary infection and contamination from the other farm in case of your farm lack of the biosecurity. So, and this picture show you the example of the our one-site system. This is a 1,200 sow with the win to finish unit. And previously, as you can see in the picture, we have this is a front. And this is a road, main road in the front, and this is a farm office, and this is a breeder and gestation and farrowing unit. Previously, this farm distributed as 3 parts. This is a breeder zone, nursery zone, and win to finish zone. And then once when PRRS into your farm, and really difficult when we try to move and to change to win to finish as a win to finish zone, right? But and you can see there's still problem. So, and for this farm, for the breeder unit, we vaccinated with a whole herd vaccination 4 times a year in sow herd. So this is a pattern of in every quarter, we monitor for the PRS, for ELISA and PCR. And you can see that let me explain about the silo profile for this farm. The blue bar is the percent of the positive for the ELISA, and the pink bar is the percent of the sample that's a higher SP ratio more than 2. And the red line is the average of the SP ratio. Well, unfortunately, in January this year, we found the first US state outbreak. This is not the first time for this farm history, but again, this is in this year when we monitor that quarter 1 and show that we have a positive for the PCR, and farm manager called to vet that okay, something wrong, vet that some like a more piglet diarrhea and a high prevenient mortality. So when we monitor for the sow herd and we pick up the sample by a serum sample, and we distribute the sample to the quality 1 to quality 6, and we also collect the sample from the abortion sow or limit sow or problem sow, and we found that for the problem sow is positive for the PCR for the US strain, and you can see that even we do the whole herd vaccination, it still have some like not 100% positive in the even in the first parity for the PRRS SP ratio. So, and we also do the monitoring in the wean to finish side, and you can see that it's kind of like a silo convert as the week from week 12 to 18 weeks. And this may be in fact around here, I assume.
That's a good point, Dr. Apisit, and let me refer to Dr. Pinero. In that previous chart, where was the timing of infection and viral circulation there, Dr. Pinero?
Yes, actually, the last slide that Dr. Apisit showed here is a really, really nice slide because it showed us the antibody dynamic in the farm in a real setting. That perhaps tell us the story when the animals has been exposed. Perhaps in order to understand this, we need to refresh some of the concepts regarding duration of viremia. So if we know when those animals are in contact, for how long the virus is going to circulate, it may give us some clue about this dynamic of antibodies when they could be detected. And this is kind of a refresh of what we did in the previous case. We will see that animals that are born persistently infected for infected sows, they're going to be viremic for a long period of time, and the antibody detection in that case is going to be really low. The different scenario is when animals are born naive and they're negative on processing fluids, serum, or even oral fluids, but they become infected in the peri-weaning area. So we're going to have a long viral detection for a period of 2 up to 5 months. And this is the area, this is the timing where we're going to see the seroconversion. And kind of much what Dr. Apisit was showing there, they saw this seroconversion about 8 weeks of age. And then what will happen with adult animals. So, but when we look into the dynamic of antibodies, this is what we're going to see. So regardless the status of the sows, when animals get exposed for the first time, and this is what is showing here, the solid line is the quick antibody response. So we will be able to detect antibodies in these first weeks post-exposure. So, and following that dynamic, we can implement a longitudinal evaluation, so different time points to determine if it is seroconversion. So basically those all the ratios, SP ratios that Dr. Appice was showing, they will increase. Basically, doesn't reflect the titer, but reflect the changes in amount of antibody that we detect on serum. This dash line here refers to the neutralizing antibodies. It's not something that we evaluate commonly. This is more associated with protection. And there are different tests. There's no common use available, but we can evaluate the neutralizing activity of the virus in serum, and also going to tell us the dynamic of the virus. Different scenario would be if we are dealing with animals that are vaccinated. So we will have neutralizing and total antibodies coming from the colostrum, and those may interfere with the one that are developed during natural infection or even vaccination. So we need to keep that in mind, and this is kind of the figure that we will see. We will see early on animals that are seropositive, a high percentage of animals that are seropositive, that are going to be winning down if they are not exposed or they are not vaccinated. So that's something that we need to evaluate. So at this perhaps period of time where we've seen the decline of the antibodies, we also need to evaluate virus circulation to determine if our animals are being exposed, and then if it is an increment on the total antibodies, is because of the virus exposure. We need to consider these two important points: role of neutralizing antibodies, induced versus passive. So we're going to achieve protection, and it's great to measure virus circulation based on the presence of antibodies, but most importantly is to evaluate activity, protection, and we need to differentiate what is induced versus passive immunity, or what is the role of the transfer neutralizing antibodies. Colostrum, they have neutralizing antibodies, and they can reduce the viral load that we observe in this pre-weaning area after weaning. Another important thing related with this would be the delayed cellular immunity response. So we know that the virus might impair natural killer cell cytotoxicity and reduce the frequency of T cells in circulation. So that would be, if we have the tools to evaluate cellular immunity, would be a really important way to evaluate viral circulation. We can also detect and use the capacity of the virus to upregulate T cells. So as soon as we see an increment of this in this cell type, it would be a way to assess viral circulation there in association with the cellular response.
Thank you for explaining the timing of infection and viral circulation. Please, Dr. Appice, tell us more about your case.
Okay, and also thanks, Dr. Pinero, for clarification. That's a really good point. So, and at the same time, when we monitor for the PRRS ELISA at the south side, and for the win to finish side at the same time, January this year, you can see that this is a really high SP ratio percentage, that higher than 2 is increased a lot, and the pattern of the silo profile is different from the previous slides. So as the same as Dr. Pinero talked about that. Well, and how about the 3 months later? This is this year, April. So every single time point, this is a cross-sectional sampling. You can be positive for the PCR for the US strain in many time points. 4 weeks, 8 weeks, 12, 18 weeks. And the last month, the virus still circulate in my farm. The pattern is still a little bit different. PCR for positive is still found in the 12 weeks, 18 weeks, and late 24 weeks of age. So they will not come alone. It's not only for the PRRS, and also come with the APP. So this is show the problem number of the dead pig per week, because for this farm previously we set up for the standard that in every week we should have like a lower 20 pigs per week to have like a mortality or dead pig. So at the time for the PRRS outbreak, you see that the number of pig dead in each week increased a lot, right? And takes about 2 months, and it's a little to like it's have to peak of the production loss. And now so far it seems like everything back to normal. The average is more or less 20 pig per week. So, and when you arrange the dead pig by age, you can see like a high dead rate is like a one after weaning, right? 3, 4, 5 weeks. And then this is two kind of production loss. Is this peak and another peak about at the 16, 17, and 20 week of age. And so we also the necropsy our pig and sent to our CP lab. And you can see that not only the APP that I show you in the silo profile is come with the Streptococcus, Salmonella, E. coli. And again, we also like in the necropsy organ that sent to lab is positive for the PRRS for the US strain. So we also do the sequencing because maybe we have a question that that the positive for the PCR is that the virus modified live vaccine, or this is a white type, or this is a previous white type outbreak before. So that and this is the answer of our question. And this sequence that's positive for this year, this is different from the what we see in the past. It causes 80% similarity, and about the same that it's about the 83% that to the when compared to the Injurvac modified live. And also the lineage 1. I hope this is not the lineage 1 that in the case 1, hopefully. So come to the next pattern. This is the pattern 2 is a two-side system with the two big side. Let me show you in the picture. We have like a big side for the sow farm 4,800 sow, and weekly weaning piglet to the side 2 that also like a big side, the same. And sometimes is when we at this time we check that for the APP, this is okay at the end of the finishing pig, the APP is zero negative. But what we found, so when we necropsy the pig at the site 2, we found like a lot of the respiratory problem in abscess, fiber tissue, and scar tissue, and a lot of like pruritus, something like that. And it's like a staphylococcus lesion or cancer lesion, and lung. It's kind of show like a really reddish and really kind of like something is lung have a problem. It's difficult to many to identify.
Very nice pictures there, Dr. Apisit. Dr. Pinero, what do you think is happening when we see initially coughing, and then eventually coughing coupled with mortality.
So, Carlos, this is really interesting. We're going to use Dr. Apis' picture here to explain a few things first. When we think about PRRS clinical signs, we don't think about cough as the first manifestation of the disease. So that's something that is important to bring up here during the clinical description. Secondly, we don't think about these type of lesions that we're seeing here, necrotizing abscessative pneumonia. So this is more commonly associated with a bacterial infection. Some of the examples that Dr. Apis shows is clearly a streptococcus infection with fiber developing in the pleura, addition to the pleura with a rib cage. So it's not the typical picture that we'll see with PRRS infection. So perhaps what we need to do is to understand a little bit the pathophysiology of PRRS to see how it leads to this type of lesions or to this type of clinical signs that have been presented. So this is kind of a summary, what PRRS does. So PRRS is going to enter by aerogenous route, and when it reaches the alveolar macrophages, it's going to replicate on them. And during the replication process, it's going to cause necrosis and death of those macrophages, alveolar macrophages, and intravascular macrophages. In addition, it's going to migrate to the local lymph nodes. It's going to become systemic. It's going to migrate to the lymph nodes and replicate in those lymphoid macrophages and dendritic cells. So in all this process, what it does is immune suppress the animals and allows to secondary bacterial infection, which reduce, of course, the clearance of the lung particles. And we have this perhaps common habitat of the respiratory tract, such as Streptococcus suis, that is going to end up taking over and causing first the bronchitis, the suppurative bronchitis, that is going to be manifested as a cough, perhaps, and secondly, this kind of suppurative pneumonia with pleuritis. The main lesion that PRRS produced before all these secondary bacterial infection happen is going to be just an acute interstitial pneumonia. So these lungs are going to be heavy and wet. It's going to be transudated in the lumen of the alveoli and observed microscopically with interlocular edema. Systemically, we already talk about what will happen when PRRS affect early on in the production. Is going to be a delayed neutralizing antibody response, which again, and a delayed cellular immunity, which again prompt the animals to be susceptible to secondary bacterial infection. And secondly, when the virus move on into the systemic phase and colonize other lymphoid tissues, it's going to be nodular hyperplasia, replication of B cells. So this is a general overview of the pathogenesis. Here is kind of a scheme what we see, and here is PRRS infecting the in aerogenous manner the respiratory tract. So taking over the tonsil and lymphoid tissue, replicating on it, and deep into the pulmonary parenchyma, affecting the alveolar macrophages and the vascular macrophages. We talk about that the first response is a severe inflammatory response that induced to this interstitial pneumonia. Is going to reduce the effect of the defense line of the lung, reducing the effect of the macrophages, allowing bacterial infection, and occasionally septicemia, where we see cases associated with Haemophilus parasuis, Streptococcus suis, systemic now, not just respiratory, and in some cases even Mycoplasma hauranus. The whole immune suppression and delay of the neutralizing and cellular response is what makes this virus persistent. So this is what we see at the lung level when the virus replicates. So we talk first about the pulmonary alveolar macrophage replication, and this is an example for it. So here is the first stage with kind of regular alveoli, really mildly infiltrated here with inflammatory cells, but heavily infected with macrophage infected with PRRS. These other pictures, is more severe. We can see the thickness of the alveolar wall, really, really thick, infiltrated by an abundant number of lymphocytes and plasma cells, and here is a intravascular macrophage that is positive with PRRS. And this is kind of the final stage, severe interstitial pneumonia. Yeah, this stage is when we see the reduction of the pulmonary function and allowing the bacterial colonization. This is the final stage of the primary PRRS infection. This is what we see grossly. These lungs are heavy, where they felt to collapse. You can see here that these lungs are still having the regular normal shape, even when they're already out of the thoracic cavity. There is already some signs of pulmonary consolidation, perhaps secondary bacterial infection. This firm lungs is basically the result of this. The alveolar lumen is filled with necrotic macrophages. All these pink areas here are necrotic macrophages that are filling up the lumen. And here is just to show how many positive virus cells we see in one of these sections. As a final result of this is again the interstitial pneumonia, really nice, bright, because of all the edema that we see on it. We mentioned about the nodular hyperplasia, so enlargement of the lymph node that is associated with this immune suppression, immune compromise. And finally, the result of all these changes is the respiratory signs. First, it's going to be just dyspnea, respiratory distress because of the alveolar edema, followed by cyanosis, so represented here by these blue ears, basically shut down in the terminal vasculature, and followed by coughing and more severe respiratory distress when the animals are getting exposed to a secondary bacterial infection. That is how we correlate the changes with the clinical signs that Dr. Apisit presented.
Thank you for that extensive explanation on what's happening, Dr. Pinheiro. Now, going back to your case, Dr. Apisit, what exactly were you seeing in the farm clinically?
Okay, thanks, Carlo, and sorry for mess up slide. In general, I think every farm the same, and we have a lot of vaccination in this kind of age, like 4, 5, 6, 7 weeks, and then they shown a lot of coughing in actually start from 4, 5 weeks, and more coughing in about 13 weeks. And the big problem is a lot more coughing and death is at this time, about 16 to 20 week of age. There's a lot of problem, and okay, I know why we have the nasty lung lesion. Okay.
Yeah, thank you, Dr. Apisit. Dr. Pinheiro, can you expound more on, it looks like a co-infection case we're dealing with this time?
Yes. And something that Viremia that Dr. Apisit mentioned, the nasty lesions. Well, we need to think about that PRRS itself, it has different flavors. So we already talked about the difference in the pneumonic process, about the different severities of interstitial pneumonia. And just interstitial pneumonia could be variable. Not even talking about potential secondary infection. The pure PRRS infection could be, the result of the infection could be variable depending on the strains. And here we have 3 examples. What we'll see, this is an experimental infection with the European strain, with the US strain, and a high virulent US strain. And as you can see, the first one with the European, there's a really fair collapse. So there's no edema, there is no interstitial pneumonia, at least at the microscopic level. When we look at the low virulent PRRS strain, there's mild pulmonary interstitial pneumonia, and then in this one, it's totally affected, diffusely affected with non-collapsing lungs and interlobular edema that we can observe grossly. So right there, we have a difference in the severity of the lesion. In addition to that, when we have a co-infection, this is what we will see. And we have to remember that through the whole production system, animals are getting exposed to different pathogens. But if PRRS is always there in the background, we will see different flavors of the primary PRRS infection. Perhaps we need to differentiate what happened with Actinobacillus pneumonia. So normally the picture that we think about Actinobacillus APP infection is acute or periacute death. But it's not always the case. Sometimes we have those animals that pass the acute infection, that can overcome the massive influx of toxins produced by APP. And the end result is those chronic animals that develop chronic pleuritis or pleuresia, and that can be manifested as cough. So the pleura itself get adhered to the peritoneum of the rib cage, and it hurts. So every time that they try to breathe or they are forced to do a sudden move, they're going to be coughing. So right there is a clinical sign that we have to differentiate with a totally different pathogenesis and totally different pathogen. Another one that also is associated with this cough is mycoplasma by itself, or even more complicated, mycoplasma with primary PRRS infections. We can see in this other picture. So the clinical sign, the manifestation of the clinical sign is the same. It's a primary cough, but the pathogenesis is totally different. And of course, PRRS by itself, again, causing interstitial pneumonia and perhaps allowing secondary infection that end up in cough. So those are the differentials that we have to evaluate. And I think that based on the presentation here, we have to reassess PRRS as a primary and the potential role of the secondary pathogens.
And all that interaction between viruses and bacteria as well. Thank you very much, Dr. Pinero. Now, let's get back to your case, Dr. Apisit.
Okay, thanks, Carlo, again. Try to match my lung lesion and with the Dr. Pinero picture. That's a really nice picture. Yeah. So let's go to another two part of the pig production. So even we have like a two-site system with the multi-loci, with the batch following, we piglet to the site to the different part, multiple of contact farming, but we still have some problem. For example, that if we win the negative piglet from the negative cell source for the PRRS, but still have some high mortality. If that piglet move pretty close to endemic area or dense area for the farm population, because sometimes we don't have a chance to choose. This is a really isolated area for the negative PRRS. So there's sometimes that we need to use the PRRS vaccine to reduce the PRRS negative piglet when we move and rest in the PRRS positive area. And also, sometimes you can see that even we have the same cell source, but the site to show the different result in the mortality. This is sometimes in some farmer or some place, this is really low mortality, sometimes really high mortality. Even you have the same sort, the same original of the herd health that you can see. So now I think we are on the step 3. We already know the design goal, and we know the current PRRS problem, and now we know the limitation of our situation and what we need to do. And we're gonna talk about the next, about how to develop the solution, and again, and how to we improve our after we develop the solution.
So before you proceed, Dr. Apisit, on the solution and the monitoring of it, the getting to be more interested now, let's pause for a 15-minute break. And when we'll come back, we'll give a cue. We'll let Dr. Pablo Pinero talk on diagnosis after the break. So 15-minute break. Welcome back after the break. And as promised, we're going to dive deep into diagnosis. I would like to focus particularly on differential pathology. Dr. Pablo, is there, and another question would be, is there such a thing as the right diagnostic approach?
That's a really good question. The right diagnostic approach, I mean, based on all we have seen so far, is based on the question, on the clinical question. But in order to request the right diagnosis, we need to know what we want to learn about the disease. So in order to do that, I'll try to walk you through some of the approaches that we could use to make the diagnosis. So, of course, clinical presentation and presence of lesions are going to be the leading source of our diagnosis. So here is an example of what we can do based on morphological changes, and more in detail based on histological changes. As we mentioned before, PRRS may come in different flavors, different severity, different degrees of lesions, and this is a clear example here. These two sections of lung have PRRS pulmonary lesions. But as you can see in this one, there is a severe interstitial pneumonia, thickness of the alveoli, mild peribronchial cough, but nothing compared with this. So here there is no novel pulmonary parenchyma left. So there is no alveolar lumen, there is no place for oxygen interchange at all. Instead, all these alveoli are filled with necrotic macrophages, and in addition, some ongoing suppurative bronchitis. So that would be perhaps the first approach that we will use to make the PRRS diagnosis. Just look at the lesions and see if there is anything consistent or suggestive of a viral infection, and with more supportive changes like necrosis of macrophages. But we can add further, and this is something that I really like, and mostly in the presence of those programs that have vaccine in place. We know that MLB can induce a mild transient interstitial pneumonia, and that is something that we need to differentiate between what is a wild-type infection compared with a pneumonia-induced, vaccine-induced pneumonia. So we can use in situ detection methods, and that's something really important, because we can make the cause association. We don't only observe lesions that are suggestive of, but we detect the virus within those lesions. Okay, in this picture here, we have a really mild interstitial pneumonia with severe peribronchial and perivascular coughing. But most importantly, we have the presence of positive cells. So all these brown stain cells are PRRS positive macrophages. It has some limitations, of course. We need different antibodies if we know that we have a co-circulation of genotype 1 and 2, because the antibodies used for this technique, they don't cross-react. They don't differentiate different subtype. It's, of course, less sensitive than PRRS, but the important thing that we can make the association with the lesions. The best tissues that we can use for this specific diagnostic technique are going to be lung, of course, and lymph node. We have also, as practitioners, we have expectations when we want those results. So keep in mind that may take a little while. It can be, depending on the lab, could be performing 24, 48 hours. That's one of the techniques. The other one that has been the gold standard, is the virus isolation. So in order to do virus isolation, different cell lines have been proposed with different sensitivity based on the permissiveness of the cell. But basically what we're looking at here is get the suspected infected tissue, place on those susceptible cells, and look for cytopathic effect. In this chart here, what we see are dendritic cells that have been infected. They are monocyte-derived dendritic cells, which is a susceptible primary cell line that have been exposed with PRRS. And here we can see that 24 hours later, there is a tremendous cytopathic effect. That is clearly the detection of the activity of PRRS on those cells. So we can use different sample matrices to confirm the diagnosis based on this technique. Lymph node lung, of course, we mentioned those. We can use serum in that viremic phase that we've been talking about for quite a bit, fetuses, and oral fluid. What we're looking at as a marker for virus replication is the cytopathic effect that can be observed in a period of 48, 72 hours. Sometimes these results need to be confirmed with immunofluorescence or PCR. So this is the timing that we expect to get results. Within a week, we should be expecting pure virus isolation. Another technique, the most commonly used, is the genetic detection by PCR or polymerase chain reaction. Well, what this is going to do is going to detect viral RNA. It's a very sensitive technique, so keep that in mind when we are doing the interpretation of the results, because there could be false positives. It's very specific, so it can also have false negative. And the most important thing here is the viral drift. So we talk about viral genetic changes, so we need to keep our primer database updated, because otherwise we will get false negatives because we are not using the right set of primers to detect the circulating virus. Different type of PCRs are being used in different laboratories with different sensitivity, conventional shell-based, real-time, and multiplex PCR. Those are the most common used ones. And the sample matrix that we want to use, of course, could be, we can use serum, bronchial lavage, lung, lymph node, and oral fluids. Those are the most common samples. Some of them could be obtained from individual animals, some of them could be aggregated. And this is perhaps the approach that we use to different sample method for disease monitoring. So individual peak sampling, serum, blood swabs, tonsil scraping, nasal swabs, and individual oral fluids are the sample matrices that we want to use for individual detection. When we talk about population-based sampling, we will use a totally different matrix. And family oral fluids are the most common one, where we want to evaluate the presence of the virus in the following units, litter oral fluids with different sensitivity or at the prevalence level detection compared with family oral fluid, and processing fluids is another sample matrix design. So what is family oral fluids? It's a collection of oral fluid on pre-wean pigs in sows and piglets. Previously, we used to collect litter oral fluids, which is basically the exposure of a rope in the back part of the crate to the piglet. So all the piglets are going to contribute to this sample matrix by chewing the rope and embedding this rope with saliva. So instead now, what we do is have a whole family contributing to the sample matrix. We have the sows and the piglets chewing to the rope, and if there is viral shedding in that family, it's going to be picked up by PCR in these oral fluids. These techniques has improved the detection of PRRS in the following unit and has a success rate of 94%. This technique also allows us to do a more frequent and non-invasive viral detection in the following unit. When we talk about processing fluids, that's the other population technique that we were discussing. So basically what we do is we take aggregate samples composed of serum sanguineous drainage from tissue removed at the moment of castration. And normally what we do there is collect the tail dogs and the testicles. We have discussed in the previous case, perhaps some of the limitation with the tail that can bring some sort of contamination. So sometimes it's desired only to get the testicles, but the combination of both of them, here what we do is collect the samples, put it in a bucket with gauze. So we squeeze those samples, and the fluid that we collect, this is the processing fluid, and it's an excellent matrix for viral detection in pre-weaning piglets. But going back to your question, what is the best technique? Well, it all came down to the clinical question. That is the most important step. What do we want to learn? So if we want to learn viral confirmation, associated with the respiratory outbreak, with circulation, prevalence in the farm. We need, of course, to keep in mind the farm status, if it's a stable or not a stable farm, it's a vaccinated or not vaccinated farm. The prevalence, it could lead to the sample size that we're going to use. If we know there is a viral circulation in the farm, do we need to do a further confirmation, such as sequencing, to identify vertical transmission, lateral transmission? Viral exposure, remember that we described the time of viral circulation. So doing periodical sampling will determine the time of viral exposure. Viral dynamic in the farm. We already mentioned and described how is the dynamic in a naive farm after animals get exposed. But we have to, of course, keep in mind that is not the only scenario, that we have vaccinated farms, and the dynamic might change because of the presence of maternal antibodies. So if we try to put all this information in a real context, what will happen? So in a scenario of a positive sulfur, so animals may get born infected or get infected right after they're born. So the viral persistence is going to be really long for a really long period of time, about 5 months post-exposure or after birth. So that is the window of time that we're going to have to deal to make the diagnosis. So the right diagnosis there, it could be viral detection by oral fluid, processing fluids, or individual fluid when animals are already in the grower finisher stage. Keep in mind that we can use antibodies, but in this case, these animals coming from positive sows, they're going to have maternal antibodies. And we need to understand what is the dynamic of the maternal antibodies. Those maternal antibodies, depending on the immunity of the sow, but they're going to wind down in approximately a month after birth. A different scenario would be a negative so far. And what we'll see here is that we have this PRRS exposure to the piglets in the first week or before weaning, perhaps. And what we see here in blue is the viremia during natural exposure. So we have a window of a month for viral detection, and could be either detecting virus during the viremic phase, which is this period of time, or we could be associated with viral shedding in oral fluids. So again, this technique that we mentioned before, the family oral fluid, the linear oral fluids, those all come into place. Remember, right after viremia, we have the development of a sustained total antibody response. And that one comes into play the utilization of an ELISA test, for example, to understand the dynamic of antibody. Longitudinal studies will help us to understand the seroconversion. And if we have a chance to do so, the evaluation of neutralizing antibodies would be ideal to determine protection. So eradication programs may assess the usefulness of individual versus family oral fluid versus processing fluid. So all came down to the prevalence. If we are far into the eradication program, perhaps our prevalence is really low. So we need to increase our sample size, or we need to use a different technique such as family oral fluid or processing fluids. Remember, the antibody detection is right after infection in the first week, but serum is not the only matrix that we can use. We can use oral fluids, or we can use mixtures to detect those antibodies. A different scenario would be in a vaccinated farm. So animals are vaccinated pre-weaning, and what we have there is a viremia induced by the modified live vaccines, if that is the vaccine preferably used, and that has to be differentiated from the viremia observed during the natural exposure. So therefore, detection and sequencing would be ideal to differentiate those two. And finally, what is the antibody response that we observe during vaccination? Again, here came to the role of the usefulness of ELISA by a single point or multiple times evaluation. So I think that in all this context, we can understand what would be our no best test, but our preferable test in different situations.
Thank you for answering directly my question. It's always nice to get expert advice. But let us go now to the meatier part of your case, Dr. Apisit. We're moving now towards the solution part. Please continue.
Okay, thanks, Carlo. Okay, let's go to the step 4. So let's talk about what the concept we do for this case. We do the segmentation or separation. For the biosecurity rule, we separate everything that possible, like equipment, staff, worker, everything. However, sometimes we cannot separate everything. We need to do like infectious chain management. We clean, we disinfectant, and have a downtime before we move and use for another batch or for another room. So let's say it's kind of like, as you know, that we need to like all in all out system, cleaning, disinfection, isolation and quarantine. When we have a selling process, we need to like make sure that the customer truck not come to the farm. We have a pest control and staff for and downtime. So another thing that we need to do is let the pig happy. It's been like a stress-free. Try to reduce stress from the environment, from the management. So, and we also increase the immunity of the pig by vaccine and proper use for the antibiotic. So,
yes, seeing disease prevention and control, I'm calling on Lance now. Lance, is disease prevention and control profitable for us to have not just happy pigs, but also probably happy farmers as well?
Thanks, Carlo. Yes, disease prevention and control is going to have a tremendous impact on profitability. And when we talk about profitability, that is going to lead to happy producers. So what I'm going to do is jump right on in here, and we're going to talk a little bit about consistency in production. So when we start thinking about consistency, a lot of the times we talk in averages in this industry. Average is the most common statistic that producers use, but there's an issue with it. When we say an average total born of 14, this is what we think of, just this one single point. However, behind that point, there is a distribution that averages out to 14. But not just that, this distribution also averages to 14. So when we say an average of 14, we have no idea how much variability there is behind it. And as we know, disease is one of the most significant contributors to variation. So we need to get away from thinking in averages to a more dynamic approach, because then that will help us understand the true value in controlling disease and especially preventing disease. So not only do averages hide the distribution of data, but they don't really tell us anything about seasonal effects or, parity-specific effects. So in this chart, the green line represents the average farrowing rate. The blue is the actual farrowing rate. And what you can see is that there's a seasonal effect in farrowing rate, just as we kind of all know and very much correlated to temperature. But if we use the green line and we just talk about what's the average farrowing rate, what we're doing is we're ignoring or kind of concealing this trend, this pattern that's happening. And understanding these patterns and these distributions, it's crucial because that's what's going to enable us to address any problems and analyze the effectiveness of our disease control and management. So in this case here, we have pigs weaned. The red line represents the onset of PRRS, and these other lines are different treatments being enacted. And so what we can do is start to look at, how effective our treatments are. But if we just talk about, what's the average weaned, we don't really see, this level of detail that's happening that shows us, what treatments are working, how well are they working, do we need to modify our approach? So we need to get away from averages and get a more big picture approach to our production. And once we do get that big picture idea with data, we're going to start reaping economic benefits both in the short term, but even more importantly, in the long term. So when we think about averages, another issue that arises, though, is, we tend to think of distributions as being normally shaped. And what that means is symmetric. So the two sides of the distribution have the same shape, but oftentimes that's not the case. And that's especially true when we have a situation like PRRS happening on a farm. What we see is everything tends to skew more to the left, because we have animals that are getting sick, their productivity is decreasing. And so we get this long left tail. And that's very important because when we start talking about how effective are we at controlling disease and how important is it that we prevent disease, what we're really talking about is we want to pull in this side, bring it closer to the center of the distribution, because that's where the greatest economic damages are being incurred, is on these poor performers. So let's take a look at an example here. This is a normal distribution, so symmetric around the mean, which is 12.9, a standard deviation of 3.5. Now here's a skewed distribution. It has the same mean and nearly the same standard deviation, but what you see here is this long tail coming out, and we can kind of see highlighted here the key differences in these distributions. So even though statistically these two distributions are a lot alike, this long left tail is going to cause significant economic damage. So this is why controlling for disease is so important.
So Lance, it makes sense to me now that you need more than just averages to analyze performance. But could you show more examples of how variability impacts profitability?
So let's take a look at a situation here where we have nursery weights. This is actual data from truckloads of nursery pigs being sent off to finishing. So if we have a truckload of nursery pigs and the average weight of that truckload is 15 kilograms or less, what we're going to say is that those animals are going to need some sort of special treatment. They might need a specially formulated diet to help get them up to a better weight. They might need to be put into special housing. So some sort of intervention is required if they get that light a weight. So in the actual data, what we see is that 2.8%, so nearly 3% of all truckloads were below 15 kilograms. And so that's a significant number of pigs because, again, we're talking truckloads of pigs here. So that is going to have a tremendous impact in terms of additional costs, additional effort, stress on the part of the producer. But if we can reduce the standard deviation of these nursery pigs by just 10%, what we see is that the number of truckloads below 15 kilograms decreases down to 1.8%. And so that's a very significant benefit in the short term. Long term, we're going to see, more consistent weights at finishing, which is going to be far more profitable. And if these pigs are going to be sent back into breeding, we're going to see a lot more consistent weights in the GDU, which will then lead to, more consistent breeding results. So this is an example of the, by becoming more consistent, we're getting short-term economic benefits as well as long-term. Now let's look at it like this. So here is average live weight in kilograms, and there is plus and minus 1 standard deviation. And here are those nursery weights that we were just talking about. So you can see here, the variation that exists just at nursery is going to become this at mature weight. So 160 days post weaning. So a little variation here turns into a lot of variation later on. But if we could reduce the spread in these nursery weights, like I said, by just 10%, it's going to look like this at finishing. So a small change here yields a much more significant result at finishing. So, like I said earlier, better finishing weights means more profit per pig marketed. Or if these are animals going into breeding, you're going to see just a much more consistent results, in terms of born alive, pigs weaned, things like that, just through that better body condition. So this is part of the reason why we need to get away from just thinking about the impacts of disease and our approach to preventing disease. We need to stop thinking in averages, because the impacts of disease, they're numerous. And we need to really start thinking about how disease impacts the variability in these animals, because that's where there's going to be significant economic results.
Thank you very much, Lance. And Dr. Apicit, knowing that there is a right diagnostic approach, the science behind it, and we know that reducing variability does make more profit, please walk us through the solution part, the practical part of your case.
Okay. Let's see what we do to solve the problem. Okay, when as you see in the previous slide, that we have a lot of the problem with the secondary bacterial infection. We have so that's why we need to reduce the secondary bacterial infection. We use the water medication to install like a home pump to increase the water pressure inside the building. Unfortunately, the problem is the increase a lot of the high water pressure. This is not suitable for the piglet. And you can see in this picture, this is 4-5 liter for per minute. This is too much, and that's why many times that when we use the water medication, it is not successful for solve the problem. So, and when we let's go back to the previous case that I mentioned that the infection is about 9 to 13 weeks, and show with the clinical size, and the silo profile showed that for the APP is a lot of the silo convert as shown in this graph. And what we do, for the farm as a site too, we know that the pig that wean from the south side is free from many diseases, and they have like infection at the site too. So that's why we designate a worker. Previously, one worker for 2 rooms, and now we designate for the new group, 4 persons for the vaccination and transportation. And we have like, we change the worker, like 1 worker for 2 building, for this time. And so that's why we use 4 persons for like a egg building. And then when the new coming batch to the farm, a new clean person do only for the new coming batch. And as you know, okay, when the next batch coming, the same guy take care only for the new batch and only all previous batch from the newcomer pick and separate for the other worker. And step by step until the old pick or old batch move out as a finishing pick to the slaughterhouse. And let's see the result. We prove that with this method and the worker and discipline, and you can see that the no silo convert for the APP and the clinical side for coughing is reduced from the before problem. So, and this method also do in the PRS. This is shown in the graph that it's kind of like a silo convert about 10 to 12 weeks for the PRS, and the same as the previous case that the negative peak come to the site too, but still infect with the positive peak from the older batch. So we do the same, and however, it's not easy like a APP or other disease. The PRS still need to take a longer time. This is a graph show the 7 months later after we implement the management for the segmentation, the silo convert or infection move from the 8 to 10 week to the 14 to 16 week. And 1 year later, it seemed like infection moving led to 18 to 20 weeks, as shown in the slide. And 1.2 years later, it seems like we almost success that we can eliminate the PRS out. So, and the next point that I would like to share with you is the biosecurity, because as I mentioned before, that sometimes when we have a same sow sort to the piglet, but the different result, show the mortality. So sometimes it's because that they have like a cross contamination or a contaminant outbreak from the somewhere inside that the farmer. So every time when we have the outbreak or some kind of any disease, we have a team to set up and have an interview farmer, interview worker to investigate what the cause of problem. And we found that the number one problem is from the person. The person not only from the visitor or guest. This is in farmer worker, and because they usually like a daily work in their farm. So and their house pretty close to the farm. And the next is location, because sometimes when you start a new farm, it really isolated. However, 1-2 year or 3 year later, the newcomer farm pretty close to you. It's kind of really to move your farm away from your neighbor farm or backyard farm. So it's come with the pests from the rat cat or even fly. So the other point is still you need to be concerned. So for example, guilt. And as you know that if you listen my previous presentation, we talk about the selling process, because this selling process used to be the number one source of disease contamination. So after we implement the central selling house, CCTV, and we have like a transportation, our finishing pig to the slaughterhouse, not the customer truck to our farm. This is reduce the cost of the contamination from the selling process a lot. So that's you need to be concerned. And this is a kind of a example of the basic for the biosecurity. for the contact farming. Farmer or worker need to have a high discipline because they're doing the job for every day. Because as a contact farming, the farmer, their house is very close to the farm. So if they're not or lack of discipline, like go inside without shower in, shower out, this may cause some contamination. For example, sometimes they need to go inside in the morning, and that's this time they shower in, and have a lunch, go back to lunch for lunch, and go back again. They may feel that with just only have a lunch at house, don't need to take a shower again. I think this is that's why we need to say the farmer need to high discipline for their job, for biosecurity. So this is a kind of example that the layout for the contact farming. First, the house and farm need to separate, right? And every truck, actually the modern layout, every truck need to stay outside. But if the truck, for example, feed truck to inside, they need to a disinfectant and wait at least 30 minutes. And for the water, this is we need to use underground water. And even if we use the underground water, we need to clean the water with the chlorine.
Just a quick question, Dr. Apisit, probably
Yes,
while we're in biosecurity. Just on top of your mind, what are the three most relevant aspects of biosecurity in your experience?
Okay, thanks, Carlo, for your question. So based on personally experience, I think number one so far is person or farmer or worker or any person that go to the farm. So because we don't know what they do before go to your farm, or even the farmer or worker. That's why right now we have a closed circuit camera in every point that to make sure that every activity based on the high security and biosecurity. So the next number two is the selling process, because even the selling process drop a lot for the cost of the contamination. But the selling process is if you allow the truck to your farm or your worker move and step on the truck, especially the customer truck, because we don't know the customer truck go to maybe do the farm that have any problem and go to your farm without cleaning and disinfectant. That's a highly cost of disease contamination. And the third one that I think this is really significant for the biosecurity is the dead pig management, because think about the only one worker, two building, and pig have a problem and suddenly dead about 20 weeks, dead at about maybe 10 pig at one day, something like that. And how they can move dead pig about 70 kilogram to the to the place that we use for the dead pig area, something like that. This is, I think, this is also a important point that we need to concern. Yeah, this is all three. Yep, Carlo.
So people, the selling process, and dead pig management. Thank you very much, Dr. Apli. Please continue.
Okay, and as I mentioned before, that everybody need to shower in, shower out, and to make sure that not to bring any disease inside. And for your equipment, need to disinfect by the UV, or if can touch for the water, you can spray with the disinfectant spray. And if you still use the feeding bag, you need to have a downtime at least 24 hours. So for the animal zone, you need to separate booth between outside and inside to make sure not step on any disease or pathogen, bacteria, virus outside and step on inside. We have for the CP, the white booth were already outside, and before you go inside, you need to wear the black color in boot, for example. So for the truck, and you can see the truck not previously truck in front of the farm to load the finishing pig. That's a problem because we don't know the customer's truck where it from. So that's why right now we have like a walkway that moves the truck to the outside. And this truck, we have like a company truck or buffer truck that move the truck to the central selling house, not allow the customer truck go to our contact farming. So, and again, I mentioned about the dead pig management, because if you have an improper disposal pit, and sometimes we have like an overload dead pig, and we have a small pit for that. That may cause of like a pest animal, other animal go to your farm, and also may bring the other disease to your farm. So, and the last but not least, about the concept about the PRRS vaccination. So, for my personal experience, we do the vaccine for the negative piglet that move to the high density area. That, for example, if a pig move to the positive area for the PRRS, for example, we do need to make sure that the pig have the vaccination before to the really dangerous zone, something like that. And for the pig negative sow, if that really isolated, we still keep that negative sow source. And if the pig negative sow go to the positive farm, we do the vaccination. And again, for the pig positive farm, we also do the vaccination also. For the gill, if we replace for the positive farm, we do for the vaccination. Okay.
Now, Lance, I saw the euro sign in Dr. Apicit's slide, and probably you know I'm going to ask this one. $1 million question, or €1 million question is piglet vaccination worth it?
Yes, Carlo, that is the €1 million question. And the short version is yes, it is worth it. But we're going to go into a little bit more detail to understand why that is. So here is the same chart that we looked at before, looking at live weights. And so, as it's been stated before, disease is the number one cause of variation in weights. So when we're thinking of preventing disease, controlling for disease, what we're really doing is we're trying to control for that additional variation that's being created by disease. So if we can vaccinate these piglets early, what kind of benefit will that have downstream? So when we think about controlling these weights, as we talked about earlier, let's start thinking about what kind of value is being created there. So for starters, we're going to be looking at breeding weights. So we have our nursery pigs. They've been, spending some time growing up. And here at this baseline level, what we're looking at is what percentage of these females are at proper breeding weight. So as they're growing up, you can see more and more become available to breed because they've hit kind of the ideal mature weight. But if we could reduce the variation early on in the nursery, what you would see is this. So just a 10% reduction in weight variability in the nursery leads to this. So you're seeing a much steeper line here. And this is the difference between the two. So you might see, well, looks like the blue line has an advantage here. So don't these two just trade off? Are these two effects equivalent? And I would say yes, but only if your gilt management is perfect. And that's never the case. So by having this steeper line here, what we're essentially saying is that the vast majority, nearly 80% of our gilts will be available 10 days earlier. And that is just going to be a tremendous benefit, when we're thinking about assembling breeding groups, managing shortfalls in inventory. So, that's something that's very difficult to put a economic value to, but on a management basis, it's going to make things so much easier. And that is, tremendously beneficial. But now thinking in terms of dollars, we're going to look at finishing because this is much easier to ascribe a economic value to. What I did here is I got a Packer matrix from the US, and what it does here is you can see live weight. This is the penalty that a producer suffers when the animals get too heavy or too light. So as you can kind of see where this is going, if there's more variation, you're going to see more penalty. So here's our baseline group here and the various penalties that the animals are receiving. And here is that 10% less variation in the nursery. So you can see a lot more animals that are not getting a penalty, far fewer getting a penalty. So if we added up all that value, so let's assume we have a barn with 1,000 animals that are going to be sent off to market. In our baseline group, that is a total discount of $15,000 US. But with a 10% reduction in nursery weights, with the better variability in weights at finishing, that total discount drops to $11,000. So that's a $4,000 US difference, which then comes out to $15 per head versus $11. So, getting the average, like I said, the average weight of these groups is the same. So all we've done is just reduce the variation early on, and we're seeing a $4 per head benefit. So here, what we have is two histograms. This came from a prior perspective where we surveyed the attendees and asked them, a few questions about, what are growth rates like when the herd is healthy? What are growth rates like when there's PRRS? What we see here, of course, as we all know, PRRS causes a decrease in the average growth rate, but look at the difference in the variability. That decrease in the average is bad, but the increase in the variability is much worse. Now, you might look at this and say, well, 97, that's slightly less than the healthy herd, but relative to the average, this is much more variation. So you can kind of see that spread, in that long left tail that we talked about. That's a signature effect of PRRS right there. It's getting that skew to the left. So if we want to talk about maintaining long-term stable profits, we need to be controlling variation. And we control variation by controlling for disease. That's preventing it where possible. And if it does get into the herd, acting as quickly and decisively as we can to restore the herd back to a kind of normal or healthy state. So, and when we're thinking about controlling for that, the best time to do that is early on. As we just saw in these previous slides, if just a small change early in the life of the animal leads to a huge economic benefit later on. So start controlling for disease as early as possible.
Very nicely said. And I think I'd have to thank Lance and, of course, Dr. Apisit and Dr. Pinheiro as well for sharing this second case. Thank you very much.
Thank you.
Now, just to close the two cases, in case one, we had an initial respiratory problem that immediately turned into a reproductive case. We also saw the importance of vaccination, but also additional tools such as guilt acclimation and other management supportive to vaccination. We also knew that piglet vaccination pays off despite being a reproductive case. And we saw that as well, just Lance explaining recently on the importance and feasibility of piglet vaccination. Also in case two, where it was a nice sharing on PRRS control in a large farm in Asia. Despite whether it's single site or a two-site system, they still had problems of not only PRRS, but possibly a PRRS-initiated PRDC or a disease complex. We also saw the value of disease prevention in terms of keeping healthy, happy pigs, but also happy farmers as well. In both cases, the 5-step process of PRRS control was implemented. Very systematic way of solving PRRS problems. We also saw proper diagnostics and immunology. Having a nice background, a solid background on these two fields is important. In both cases, they also yielded economic and scientific results that are very sound, the true essence of whole herd vaccination.